Hi, everybody. This is Elisheva Presser again. We're about to do Chapter 2 of Halachos of Pregnancy and Childbirth. Chapter 2, The Doctor's Office. Although a woman may go to a male doctor for any examination or procedure, some posts can feel that if there is an equally competent female doctor available, it is preferable that she use the female doctor. This applies even if the male doctor is less expensive or does not charge a fee. As long as they are equally competent, she should use the female doctor. Furthermore, she may not use a male doctor who has a reputation or is known to be lax in his moral standards or personal conduct, regardless of how competent he is. 1. A doctor's examination does not render a woman a nida unless there is a penetration of the uterus or cervix. When a gynecologist or obstetrician makes an internal examination of the vaginal tract with his fingers, one need not fear that the womb was touched during the examination. However, if blood was found during or after the examination, a Rav must be consulted. In all situations, a woman should make an internal examination as soon as possible to see if there is any trace of blood. 2. If the doctor inserted an instrument into the vaginal tract, the following questions should be asked. Is there any trace of blood? From where did it come? Ask the doctor to check the instruments. Did the doctor enter the cervix or uterus? What is the diameter of the instrument that was inserted? After all the facts are known, a Rav should be consulted. 3. If the doctor performs a dilation and curettage of the uterus, the woman is rendered a nida. However, if the doctor does a pap test with a cotton swab, it does not render her a nida. If blood is seen, a Rav must be consulted. A woman who had had a hysterectomy should consult a Rav as to whether she is considered a nida. If a couple has not had children after several years of marriage and the doctor suggests that by advancing the date of immersion, conception will be more likely, or if he advises tests of sperm or artificial insemination, a Rav must be consulted since stringent prohibitions are involved. If a doctor performs a hysteroscopy using either the Rubin test or other device, as it often done to facilitate pregnancy, a thorough examination for any trace of blood should be done and a Rav consulted. A pregnant woman may have a sonogram performed to track the development of the child if the doctor considers it medically necessary or desirable, but it should not be performed solely to discover the gender of her unborn child. 7. A woman who visits a male doctor, whether a Jew or Gentile, must be very careful to avoid the prohibition of yichud, being completely alone with a man. A woman may not be alone in the examining room with a male doctor with the door closed, especially if her husband is not in town. Any one of the following circumstances would avoid the prohibition of yichud. A. If the door is left open and people are in the waiting room. B. If the door to the examining room is closed but not locked and someone may enter the room without knocking. If the door is unlocked and it is not customary for someone to enter the room unannounced, it is considered yichud. C. If the door to the examining room is locked but someone has the key and may enter the room unannounced. D. If a woman takes a child, even not her own, into the examining room. It is also permitted if the child is placed in an area where the child can hear what is going on inside the examining room. The child may be a girl between the ages of 5 years and 9 years and 1 day, or a boy between the ages of 6 years and 9 years and 1 day. If the husband of the woman being examined is sitting in the waiting room. This is permissible even if the door is locked. It is also permitted if the woman being examined is accompanied by another woman whose husband is within the city limits and knows her whereabouts, or by a close relative, mother-in-law, sister-in-law, husband's sister, stepdaughter, daughter, son. If the husband of the woman being examined is within the city limits and knows where she is, it is permitted for her to be alone with the doctor. F. It is also permitted if the doctor is Jewish and his wife has a key to the examining room. 7. To avoid the problem of yichud, a woman should only remain as the last patient in the doctor's office if the nurse or receptionist is still there, or if she is accompanied by another person as explained above. 8. Aminosities should not be performed routinely in pregnancy. If there are specific reasons in a particular case, a Rav should be consulted. That is the end of chapter 2. I hope you enjoyed this video. Stay tuned tomorrow for chapter 7 of Kashrut in the Kitchen and chapter 3 of the Halachos of childbirth, of pregnancy and childbirth. Have a great day, everybody. Hope you enjoyed this video.